All right. Thanks so much, Suparna, and to the Maryland Public Health Association for co-hosting this webinar. Thank you, everyone, for joining. My name is Rebecca Rear, and I'm the Director of Climate Policy and Justice at the Maryland League of Conservation Voters. My background is public health, receiving my MPH from the University of Maryland, so I'm excited to hear from our speakers later, and also be here with all of you. Maryland LCV is a statewide nonpartisan organization that uses political action and education to protect our air, land, water, and communities. Maryland LCV endorses and elects pro-conservation candidates and holds elected officials accountable through legislative scorecards and advocacy. Our vision is a healthy environment for everyone in Maryland. We're honored to be part of this effort and recognize the key role health professionals play in educating others about the impacts of climate change, making it personal and meaningful, as well as taking proactive action through preventive care and policy advocacy. So as part of this webinar, you all are the first to see it. We're excited to officially launch our new fact sheet. Sharing some screenshots here you'll see on the webinar, but we encourage you to check it out now. It's live on the website, and you'll see a link in the chat in a moment. This fact sheet provides an overview of the specific health impacts Marylanders are seeing in a changing climate, making sure we're clear on the culprit, burning fossil fuels, and then details impacts to particularly vulnerable groups. We end with opportunities for action and ways that you as health professionals can make a difference, both in the personal actions we take and the policy advocacy that we do. Just want to make sure we thank the groups who are part of this effort: the Alliance of Nurses for Healthy Environments, the Maryland chapter of the American Academy of Pediatrics, Chesapeake Physicians for Social Responsibility, the Children's Environmental Health Network, Elders Climate Action, Maryland PIRG, and your co-hosts for today and for this effort, the Maryland Public Health Association and the Maryland League of Conservation Voters. I'm going to hand it back over to MDPHA's President, Suparna Navale.
Thanks, Rebecca. A few logistics before I introduce our speakers. Please use the chat for sharing any resources, and there's a Q&A feature at the bottom of your Zoom window to ask any of your questions. All questions will be answered after the presentations. Our two speakers today are Dean Boris Lushniak and Delegate Lorik Sharkoudian. Dr. Lushniak has been the Dean of the School of Public Health at the University of Maryland since January 2017, after serving as Department Chair of Preventive Medicine and Professor of Dermatology at the Uniformed Services University. He was the U.S. Deputy Surgeon General from 2010 to 2015, Acting Surgeon General from 2013 to 2014, and was responsible for the 50th Anniversary Surgeon General's Report on Smoking and Health and the Surgeon General Call to Action to Prevent Skin Cancer. During the Ebola response in 2015, he commanded the U.S. Public Health Service, Monrovia Medical Unit in Liberia. He attended Northwestern for his bachelor's and medical degrees and Harvard for his MPH, and completed residencies in family medicine and dermatology, and is certified in dermatology and preventive medicine. He began his USPHS career in 1988 in the Epidemic Intelligence Service and served with NIOSH until 2004 and was part of the team at Ground Zero and the CDC anthrax team. In 2004, he transitioned to the FDA in the Office of Counterterrorism and was appointed FDA Assistant Commissioner in 2005. He retired from the USPHS in 2015 as a two-star Rear Admiral after 27 years in the Uniformed Services. And our second speaker is Delegate Lorik Sharkoudian, who represents District 20 in the Maryland General Assembly, where she serves on the Economic Matters Committee and is a chair of the Unemployment Insurance Subcommittee. Lorik is a strong advocate for legislation promoting environmental justice, consumer protections, economic justice, criminal justice reform, pedestrian safety, and a sustainable food system. In addition to her role as delegate, Lorik is the executive director of the Community Mediation Maryland. Lorik received her PhD in economics from Johns Hopkins University and has been honored 3 times as Maryland's top 100 women by the Maryland Daily Record. She lives in Tacoma Park with one of her 2 children, Rafi, and runs ultra marathons. So please welcome Dean Lushniak.
Great. Well, thank you so much. This is a distinct pleasure to be here with Delegate Sharkoudian, as well as with this esteemed group of attendees. As mentioned, my name is Boris Lushniak. I'm the Dean of the School of Public Health at the University of Maryland, College Park. Go Terps. And I first of all want to thank everybody for not only attending, but in particular the Maryland Public Health Association and the Maryland League of Conservation Voters for sponsoring this event. In these next few minutes, I'm going to talk about climate change and the concept of One Health, and really looking at it not only from the sense of the local scenario, right? And we saw some of the statistics that show us how we are influenced by climate change within the state of Maryland, but also to look at it globally, right? As a public health crisis in action. Next slide, please. First of all, disclosure, I don't have any relevant financial relationships with any commercial interests. We're not going to be talking about drugs or off-the-label discussions. I am supported by the state of Maryland and formally with the U.S. government in the variety of agencies in my 27-year career in uniform as a Public Health Service Commission Corps officer. Next slide. I'm going to start off with real basics because as we talk about climate change, we're going to talk about the idea of implications on health. And I'm a strong believer in this definition, right? This definition, which some people will say is aspirational, states the following, right? That health is a state of complete. Perhaps that's the aspirational component, complete. Complete what? Complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now listen to those words again, right? A state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So when we talk about the idea of health and implications on health as a result of a variety of parameters out there, certainly a virus, a novel virus infiltrating our society, something called COVID, right, did affect health and affected health in all the realms, complete physical, mental, and social well-being of our society. But at the same time, as we talk about climate change, the implications, the big picture implications on this wide-ranging concept of health is quite evident, right? The ability for climate change to affect us physically, to affect us emotionally, and to affect us on the social well-being spectrum is quite evident. Next slide. When we talk about health, it's determined by a variety of patterns. This is, in essence, a busy slide, but I want you to look at sort of the second line there, right? We talk about the determinants of health, where and how we live, learn, work, and play. And then health is modified by what? Or the parameters that determine health are our social environment, our physical environment, our genetic environment. And in essence, when we talk about climate change specifically, it really deals with our physical environment, right? The idea of how is the body going to be adapting to higher and higher temperatures? How is that body being able to work, to play, to be able to live in those higher temperatures? At the same time, the physical environment is changed by climate patterns. For example, right? Insects that never were in our sort of microbiome, if you will, or macrobiome, the whole issue of Lyme disease, the whole issue of malaria appearing, right? So the physical environment plays a role in terms of disease. It also plays a role ultimately in the bottom line of this chart, showing the well-being and the prosperity of us as individuals. So the physical environment, as determined by a variety of factors, including the climate, will play a role as a determinant of health and diseases in our society. Next slide. I'm going to talk briefly about public health. I'm a public health person. I view my career path, although trained as a physician, as being a public health practitioner. And when I talk to my students here at the University of Maryland, we talk about public health, and I go back 100+ years now to a definition by CEA Winslow that talked about the 3 Ps of public health. It's the idea of preventing disease, the idea of promoting health and well-being with the ultimate goal of prolonging a high quality of life. Now, who plays a role in public health is just as important. The second part of that definition is critical. So it's about preventing, prolonging, promoting. But ultimately, it's not just one party's responsibility. And part of our plea to you today is, in essence, to become advocates of public health, to become advocates of our work on climate change, because of its role in the health of our society, because public health ultimately is in the hands of what? The organized efforts and informed choices of who? Here we include society as a whole, of organizations such as those sponsoring this webinar, of both organizations, both public and private, of communities. And yes, I dare say public health is the responsibility of individuals. And today we're really going to plead to you to become advocates as individuals, as members of organizations, as members of a community, but also as members of society, that we have a role in the bigger public health picture, including the role in terms of inducing change and policies for climate correction, right? So that climate change doesn't induce the public health implications that it is on a pathway to further induce. Next slide. Now, when I talk about One Health, it really brings aspects together here, right? As a physician, I was trained in the realm of human health, right? And for the longest time, physicians, the medical profession, as we see it, really was about human health, right? We take care of human beings, right? It's a bold and noble calling in terms of both the diagnosis, the treatment, the therapeutics, the diagnostics, all these things, right? Out there as tools in the realm of human health. When we talk about One Health, we now talk about the world quite differently. First of all, this is a collaborative, multi-sectorial, transdisciplinary approach. It works at the local, regional, national, and yes, global levels. The goal of achieving optimal health outcomes in this One Health approach, because what does it do? One Health really recognizes the interconnection between people, between the animal world, between the plant world, between the globe, between the climate, right? The whole shared environment. Next slide. So when we talk about this, the One Health approach really does endeavor this triangulation. There's the human health component, right? Doctors, nurses, public health people, the animal health component, the environmental health component, all working together in unison to affect the health of each of these entities. But at the same time, the One Health approach is that these are interconnected. So the health of the animal world and the health of the globe, of the planet, is intertwined with human health. We can't be independent anymore, just working our own shtick, so to speak. Next slide. Now, we talk about changing factors of One Health, they are quite evident. First of all, human populations have been growing, have been expanding. There's closer contact with wild and domestic animals. There's changes in the climate and land use, disruptions in the environmental conditions and in habitats. There's increased movement of people, animals, and animal products. And these result in more opportunities for diseases to spread between animals and people across borders and around the globe. But it's not strictly just infectious disease oriented. We also now see, for example, as I mentioned, the whole issue of potential problems with the insect world, right? With insects coming into environments where they no longer existed, perhaps carrying infectious diseases, but also at the same time being influenced by climate changes, by the changing patterns of weather, the changing pattern of ocean currents, the changing pattern of winds on this planet. Next slide. Now, back in 2019, and I'd like to go back, looking back in the pre-pandemic period, because certainly after the pandemic began, we began focusing on the idea of the infectious disease of COVID. And certainly it was an incredible public health crisis that unfolded. I view this time period as actually being part of syndemics, right? The whole issue of the multiple factors that are influencing the public's health. One can say that at the same time, we were going through political upheaval. Did that have public health implications? Without a doubt. We were going through the idea of frank aspects of racism in our society, of poverty, of the idea of underemployment or unemployment. All these things that were going on do have public health implications. So in the pre-COVID period, however, not looking at what took place over these last few years, already the WHO listed 10 big threats to global health. This is just on the cusp of the pandemic. And notice listed there as the first was air pollution and climate change as a key threat to global health. You'll see the listing. You can read through the listing of others. Yes, by the end of it, you can see Ebola and other high threat pathogens were listed. That ultimately was, the high threat pathogens became a novel virus, the coronavirus that infiltrated our society. But if we look at air pollution and climate change, it has been recognized at the highest global levels, the World Health Organization, as being an issue, right? Threats to global health. Next slide. So ramifications of this, and now it's the concept of the One Health approach, right? What is going on with the planet? Air pollution and climate change. What effects does it have? 9 of 10 people breathe polluted air every day. Kill 7 million people each year from cancer, stroke, heart, and lung disease. 90% of the deaths are occurring in low and middle income countries. Burning fossil fuels, which obviously play a key role in climate change, are a major contributor to that climate change. Expected to cause 250,000 additional deaths per year from 2030 to 2050 as a result of multiple causes: malnutrition, malaria, diarrhea, heat stress. On course to warm the planet by more than 3 degrees centigrade in this century. It's probably even going, some of the measurements are going even beyond that. So the ramifications from the global health pattern, that component of One Health, are obviously very concerning and need to be taken quite seriously by us as a society and as us as public health people, right? We are part of that society to protect, to promote, right? To prevent and to prolong. Next slide. Now, as I conclude sort of this intro to the global aspect of climate change, the ramification on our society, I go back in time a little bit here as well. And back in 1999, CDC, in their Morbidity and Mortality Weekly Report, their journal, listed the 10 great public health achievements of the previous century. And you can see the listing here, right? There were things that didn't even exist at the beginning of the century that, in fact, ultimately were successes. Things like motor vehicles, right? Did we have cars in the year 1900? Well, there were experimental models, but certainly cars changed our form of transportation. Motor vehicle safety was one of the success aspects, right, of looking at at public health achievements in that century, because you had a new technology, a new way of transportation that, in fact, inflicted injury and death in our society. I use that as an example because oftentimes, even at the beginning of a 100-year time span, that century, we don't even know what's going to become our public health problem. In this case, there's a tie-in because motor vehicles that are, in fact, a major source of pollution, the fossil fuels that are out there. So now when I look forward and looking at this list of saying, here's what public health achieved in the prior century, next slide. What I want to put out to you, right, as part of, our plea to you is, what are we doing about the 10 great public health achievements now in this next century? Sometime in the MMWR in 2099 is going to come out with an issue, right? It's going to come out with an issue. And it's going to list the 10 things that we did right in this century. And I dare say right now is the time period for us to define it. We play a role each and every day in setting up this list. Climate change and our response to climate change needs to be one of these 10 great public health achievements of this century. So I put out the gauntlet to you to become activists, to be involved in this. This is not just something that's passing, right? We passed through a pandemic, we went through a crisis, and now we're on a different pattern as a result of our relationship with this infectious disease. Climate change is not going to be that easy to solve. Climate change is not going to go away in a few years, and yet the work begins now. So thank you so much for your attention. I'll be happy to answer questions later on. But at this point, I'd like to introduce the delegate, Delegate Lori Charkoudian, who is going to discuss her perspective on climate change. Thank you so much for your attention.
Great. Well, thank you so much. What an honor, Dean Lushniak. I'm honored to be on this panel with you, and thank you to our sponsors. And I love being able to follow what you did, because I feel like you effectively made the case for why public health folks ought to be involved in the climate change work. And I'm now going to make the case for the specific kinds of legislation that I hope to see you in front of the Economic Matters Committee talking about. So I think what happens in the context of health and conversations about health in the General Assembly in Maryland is that you tend to see public health folks showing up in the Health and Government Operations Committee in the House, and in the committee that deals with health in the Senate. And what I really hope that by the end of today, you'll be excited to do is to show up in the committees that deal with energy and environment, which is the Economics Committee in the House. The Economics Committee has all the energy legislation, and then Environment and Transportation has other environmental legislation. And I think there's some things that I think are sort of the more obvious connections that people might see themselves participating in. I did, for example, a couple of years ago, have a heat stress standard legislation. And so on that one, we had health and occupational safety folks who were participating in that conversation. And, I hope that continues. Of course, that was related to employment and labor standards related to heat stress. And we had to do that. We have to do that. We need to continue doing that because of hotter and hotter summers. And certainly this question about when OSHA is going to set their own heat stress standards. My bill sets standards for the state of Maryland. When OSHA is going to set them for the country, it sort of comes up every summer, and the New York Times and everyone does a piece on it, and then it sort of goes away, and we're still waiting for national standards on that. But in the meantime, we'll continue getting it right in Maryland. Well, what I want to talk about is a lot of the energy legislation that we see in my committee, and that really has implications for public health on two different levels. And I want to kind of walk through. So right now, what you're looking at is the screen that describes the offshore wind legislation that I passed this year. And so this bill, from a climate change perspective, from a clean energy perspective, has some pretty straightforward benefits. 8.5 gigawatts of offshore wind in the state of Maryland is really important for our ability to get to 100% clean energy. But specifically what that means is, in addition to its implications on slowing down climate change and really potentially mitigating the worst of it, it also has implications for our ability to shut down coal-fired power plants and other fossil fuel power plants. So whenever we get the development of clean energy right in Maryland, and in this case, 8.5 gigawatts is enough to power 3 million homes. Whenever we get that right, what you can think about is all of the polluting fossil fuel plants that we can shut down. And so what it means is that we not only have a bill that is going to have implications for climate change itself, but we also have a bill that is going to clean up the air, and all of the localized pollution and the health impacts that are associated with that. And so this was one example of that. I will say one of the other things that I try to do in all of my legislation, I'll mention it here, but it applies to several legislation, is to address issues of income inequality, issues of equity, and issues of worker treatment and worker standards. And I think that in this case, it was about the job standards that we created associated with the burgeoning offshore wind industry, which will be a new industry for Maryland. And I think that, tying into the very broad conversations that the dean just had, when we're looking at social determinants of health and poverty as a social determinant of health, we have this opportunity as we're building these new kinds of clean energy industries to really develop those industries specifically with a race to the top, as opposed to the race to the bottom, which we've seen in a lot of economic development over the last 50 years. And so I think that I would argue that also has implications in terms of social determinants of health and for public health implications. And so I would hope that folks would get involved in the conversation from that perspective as well. Next slide, please. The second area that I have done a lot of work in, and that we see in front of the Economic Matters Committee, is this issue of energy efficiency. And in particular, the area that I've focused on is energy efficiency for low and moderate income households. And what we know about energy efficiency is a couple of things, but it is tied directly to healthy housing. So it's actually, this concept of green and healthy housing, and there's an organization with that name in Baltimore City that does excellent work. But what happens is right now, the vast majority of homes that, so let me actually just back up a second and put energy efficiency in a climate change context. In order for us to address climate change in the energy sphere, what we need to do is we need to use less. So efficiency and conservation, right? The cleanest electron is the one that we never use. We need to electrify everything because we can clean up the electric grid more than we can more easily than we can clean up fuels. And we need to clean up the electric grid, right? So that's the offshore wind piece of it. So this fits in the use less category. But when we talk about using less, when we talk about efficiency and conservation, we have this opportunity to really look at the intersectionality of a whole bunch of different things that are going on. And so in this particular case, part of what has been happening on the energy efficiency side is we have had in the state a nationally recognized energy efficiency program called Empower. And Empower has gained efficiency at the rate of 2% increase efficiency, essentially using 2% less a year in the residential setting over the course of many years. And it is considered a nationally recognized, really, really good program. But when we pull out from that 2%, what is the benefit that is going to the lower income households, so low moderate income households? What we find is the gains in those contexts are 0.04% 1 year, 0.1%, 0.2%. So there's this extraordinary inequity in how our energy efficiency programs are being implemented. And to add to it, when we dig deep into what's going on, what we find out is that it is tied to a healthy housing issue. So what happens is you go into a home that is suffering and struggling to pay an electric bill. And so the best thing to do if you're struggling to pay your electric bill is to weatherize that house, to seal up the envelope so that you're not, paying for heat that's actually seeping out your windows, and to put in efficient appliances. But what happens is when you go into many of these homes, you find a leaking roof, you find mold, you find lead, you find asbestos, and you can't seal up a home that has mold in it because you create a greater health risk. And so what was happening is because there was the money for efficiency cannot be spent on mold remediation, that home would be looked at, would be determined to be ineligible for the weatherization, and instead folks would get a bunch of efficient light bulbs, which are great and helpful, but don't solve the underlying issue for that household. And so what this bill did is it really kind of brought together and stacked a number of different funding sources for whole home retrofit. So we can do energy efficiency, which is important from a climate perspective, also from an individual health and safety perspective. And we do all of that together, so we can build equity into our efficiency programming and address health and safety issues at the same time. Efficiency and people's ability, obviously, to keep their homes cool in the summer and warm in the winter is also crucial in terms of all of the implications for health, that, asthma, if you can't have a warmer, asthma with inefficient homes, with leaky homes, cold in the winter and hot in the summer, are exacerbated, and all those other things. So these are the kinds of investments that are both really good for the planet and really good for individual and public health. And so this was a particularly exciting one that had all of those things really clearly interconnected. Next slide, please. Another thing that we've worked on in Economic Matters Committee, again, not the place you're thinking that we're doing health work, but here we are doing all this health work, is this issue of, because we have energy assistance as a piece related to energy policy, we end up with the questions about energy assistance in front of the Economic Matters Committee. And what we'd found was that our energy assistance funds are very, very difficult for people to access. And so again, now you have people at risk of having their gas and electric shut off. And even in that case, they have a lot of difficulty accessing the funds that are available for energy assistance. So again, tying this to both the very direct health impacts of the danger of having one's electricity shut off, and then of course also tied to the social determinants that are associated with poverty. And so what we passed this year is we streamlined the eligibility requirements so that everybody who is enrolled in SNAP will automatically be enrolled in energy assistance. And that will begin in January of this coming year. Parallel to that, I had a separate bill that was, as you would expect, in the Health Committee, which is the categorical eligibility for Medicaid. So again, similarly, you would have everyone who's enrolled in SNAP automatically enrolled in Medicaid. And these are these opportunities that we have to streamline access to these crucial services. Next slide, please. I'm going to talk briefly about geothermal heating and cooling. In 2021, I passed the first bill on geothermal heating and cooling. And this is basically taking the heat and the coolness of the earth, which is just 5 feet down, a steady 55 degrees in Maryland. And that can be used through a heat pump system to cool homes in the summertime and to heat homes in the wintertime. It's super efficient. And what it does from a greenhouse gas emissions perspective, because it is so efficient, it both has it both cuts emissions on an ongoing basis because it uses less energy. It also cuts emissions in peak periods when we have the highest emissions, and the highest polluting is happening generally in the peak periods when the peaker plants get turned on. Those are usually the dirtiest and the most expensive plants, but at the peak usage, when like in the very, very hot days of the summer, geothermal has the potential to use less during peak periods than any other electrification scenario. And most important, at the individual home level, it creates that heating and cooling with no combustion. So unlike a gas-fired boiler, there's no combustion in the home. And so all of the implications of combustion in the home in terms of the health implications of NO2 levels, of the possibility of carbon monoxide poisoning, anything that's associated with combustion of gas in a home or combustion of other fossil fuels, propane or otherwise, we get rid of with the geothermal or other heat pumps. And what I would highlight about the work that I've done on the geothermal is in the bill that I passed in 2021, we had the carve out within the carve out about the geothermal RECs that have to go into low-income communities and communities that are disproportionately affected by climate change. And so what that's meant is, in particular, we're hoping, and we're starting to see, although it's been a little slow in the implementation, we're hoping more and more schools that currently burn fossil fuels will be able to benefit from geothermal and really cleaning up the air in schools in lower income communities, as well as community centers and residences, multifamily and single family. Next slide, please. We're taking this geothermal concept to the next level with network geothermal, which is even more efficient than an individual geothermal system. And what this bill is coming up in the upcoming legislative session, and what this is going to do is actually allow us to transition an entire neighborhood at one time. So while the geothermal by itself happens maybe a building by building, this will allow for an entire neighborhood to be transitioned to a network geothermal system. It's the most efficient possible way to heat and cool our buildings. So really making a massive difference in terms of the energy that we're using, meaning a difference in the greenhouse gas emissions, also making a huge difference in the peak energy usage. But what's really exciting about this is the way that this pilot is structured, we're going to have the opportunity to transition an entire neighborhood, and the bill prioritizes low-income neighborhoods, an entire neighborhood at one time to geothermal heating and cooling. And the way the bill is structured is it will also electrify everything else in their home. So we'll be getting people an induction stove, which means that they won't be burning fossil fuels in their kitchen, with all the health implications that has, and gas, transitioning off of gas dryers if people have those in their homes. So this is coming up soon. I will just mention a few other things that we have in our committee, and one of the issues that is very directly tied to public health is this question about what do we consider renewable energy, and I don't think I have a slide on this, but the renewable energy, what is in our renewable energy portfolio that gets subsidized as renewable energy. And I'm sorry to say that there is mostly good stuff in there, but there is one very dirty thing in there, and that is in trash incineration. And I think for folks who are in the Baltimore area or anywhere in Maryland, you may be very familiar with the fact that trash incineration, especially the Baltimore plant, causes extraordinary health implications for the surrounding communities and all the suffering that goes along with that. And unfortunately, right now, because of a history of a decision that was made before I was there, that plant currently receives subsidies under the clean energy subsidies that the state has. And so that is another example of where, we really need the voices of folks doing public health work in that conversation, highlighting how subsidizing that as quote unquote clean energy, not only is it not clean energy, so we're subsidizing that and that money could be going to real clean energy, but it also is causing extraordinary harm and suffering in the community surrounding it. So very quick overview, and I really do hope to see folks get involved in these conversations, and I'm happy to take questions.
Thank you both so much for those great presentations, and we do have questions. One question, we're talking about 8.5 gigawatts from offshore wind. How does that compare to the current electricity use in Maryland?
Yeah, that's a good question. I think it ends up being about a third of the current usage. There's a couple of different numbers and a couple of different ways that we measure it. And I think the thing that we need to be preparing for is there's the current usage, and then there is the expected usage by 2035, because we hope to electrify so much more. So our actual electricity use will go up between now and 2035. And so when we're talking about hitting 100% clean energy by 2035, we've got to calculate into that we're going to be using more than we're using now, because we're going to be getting rid of all the natural gas.
Right. So we're going to need more clean energy sources in Maryland. And what plans are you aware of to help us get there?
So wind, the offshore wind is going to be a really big piece of it. Solar, and I think what folks may know is that right now solar, we have the goal of a 14.5% carve out for solar, which will be again a large chunk of what we need to get there. I think that right now, and what we expect to see in the upcoming legislative session is really sort of an implementation bill, like work that needs to be done on implementation. Because I think we know that if we can get to the 14.5% carve out of solar, will be, between the solar and the land-based wind we have access to and the offshore wind, will be a good ways towards 100% clean energy. The challenge right now is what we do to make sure that we can actually get to that 14.5%. And there's a number of structural issues that need to be addressed. Excuse me. And they are, and there's folks who are working on those. And so I think those are going to be some really important things to do in the next couple of years. And then I think the other thing, as I was saying, will be increasing electricity use, because we'll be electrifying everything, vehicles and buildings. But the way that we electrify those things and the efficiency that we add to the electrification will be really helpful in making sure that we are sort of that the number we need to hit to get to 100% isn't as high as it would be if we electrified everything without that efficiency.
Great, that's a really important point. Are there other things that the General Assembly can do to push the utilities to move away from coal and gas more quickly?
Well, yeah, so sort of a couple thoughts on that. I think the RPS is what we have right now, the renewable portfolio standard. And so that's a piece of it. And then I've talked about several other pieces at the solar carve out, the offshore wind. I think that to move away from gas, there's two pieces to move away from gas. One is the gas for energy generation. So in a generation plant. And I think that sort of is going to be the last gas that we get rid of, probably. That is harmful, but what's more harmful is the gas that's being burned in people's homes. And so that gets back to this piece that I was talking about, the network geothermal, but other electrification and all of the work that we're doing to really make sure that folks can access the IRA, getting air source heat pumps into people's homes, getting induction stoves into people's homes. All of that is part of moving off of gas. And so the kinds of things that you're seeing in the General Assembly, you'll see this year we expect to have Empower reform. Empower is the energy efficiency program, and really making sure that our Empower program is only funding efficiency that is also electrification, so that we're not funding sort of quote unquote more efficient gas stoves or more efficient gas boilers. That's a really important piece to move away from gas in the homes. Second, you'll see within the context of you'll see I think we'll expect to see a sort of all electric new building requirement. That's really important. When you're in a hole, stop digging. And so at the very least, there's work to be done, and it's a little more complicated to retrofit the homes that are already there on gas, but it's so clear that we can get all new homes to be electric. And so that is a really important thing that we're going to see this year. I would also highlight some things that we have seen in the past, and I think we need to keep paying attention to this. A couple of years ago, I had a distribution system planning bill. Now, this gets a little bit wonky, but it's really important, and I said it in passing. The dirtiest energy, the gas, I'm sorry, the coal, most of when we see coal being implemented and turned on in Maryland is when we are at those peak levels of energy usage. So they basically sit all year long, and then those really hot days where everyone's turning on their AC and we have this peak period, all the coal gets dispatched. And so you have coal being run now for 30 days, maybe out of a year, but it's being run on the days that are the hottest, that have the worst air quality, and it's then adding to the air quality on those days. And so one of the ways that we can affect not having to turn those on, when I talk about peak shaving, when I talk about things like demand response that happens, that when the utilities basically call you and say, turn your thermostat up, stop using so much AC, or you get a credit if you use less AC tomorrow. But we can do all of that in a much more sophisticated and technological way. And we can do that with smart meters. We can do that with smart thermostats. And we can also do that with bidirectional charging with our vehicles, with battery storage in our home. So there's all kinds of creative things. We tend to spend a lot of time saying, how do we get to 100% clean? How do we deal with these peaks? How do we retire coal? A lot of it has to do with adding new energy that is clean to the grid, and that is crucial. But a lot of it has to do with how we manage the grid that we currently have. And there's all kinds of creative things that we can do, technological things that we can do with the grid we currently have that can decrease our peak, especially our peak use of the dirtiest fossil fuel plants that we have in our state.
Thank you so much. And we have more questions. Maybe we can get back to at the end. I need to give this back to Rebecca so she can tell us about upcoming opportunities.
Thanks so much, Francis, and keep the questions coming. We will have more time at the end, but we just want to make sure everyone has the opportunity to know what's next. And so there's if you're hearing about One Health and getting inspired to act, and then hearing exactly the opportunities to weigh in with the Economic Matters Committee, but think you need support to act, that's why we're here. So we're, again, today, as part of this webinar, launching the Climate Ambassadors Training. This is in partnership with an organization called Eco America and their Climate for Health program, which has designed a training for health professionals all about health impacts of climate, communicating on climate and health, advocacy and engagement. We get into solutions and benefits. And so this training is available now for free, just for Maryland health professionals. So you can go online now and sign up to take the training asynchronously. So take it with your colleagues at your convenience. And this link is available live now with the code MDPHA. So sign up, start your training. You'll get full list of instructions. There's also continuing education credit available when you take this training. So we're here to provide you with resources to act. So step one is to take the training, check out the link and use the code MDPHA so we can stay in touch with you when you sign up that way. And then because you're going to be taking this training online, asynchronously, sort of with but not with your colleagues, we're inviting everyone who takes that training to then join us in person on December 8th for an in-person workshop and networking opportunity. So stay tuned for exact location details. We're just working out a few more things on that, but it'll be the morning of it's a Friday, December 8th. Take the training, come join us. You will note that December is just before January, which is the start of the legislative session. That timing is on purpose. So we hope that you can take the training and feel confident in your as a health professional and your advocacy on climate and health. So make sure you sign up for that training and come join us in person. I'm excited now to hand it over to Roxana Maya-Fuentes to talk a little bit about Children's Environmental Health Day, which is coming up in just a few weeks.
Thank you, Rebecca. Hi, everyone. My name is Roxana Amaya Fuentes. I am the EcoHealthy Childcare Senior Program Associate with the Children's Environmental Health Network. And thank you, Rebecca and Suparna, for inviting me today to present along with our previous fantastic speakers. So the Children's Environmental Health Network, we are a nonprofit organization based in Washington, D.C., and our work focuses on protecting children from environmental hazards and promoting a healthy environment, and also protecting children within childcare facilities. So Children's Environmental Health Day is happening on Thursday, October 12th, and that you're all invited to. So this day takes place on the second Thursday of October each year, and it is focused on action and equity. And the goal of CEH Day is to collectively increase the visibility of children's environmental health issues, while also empowering individuals and organizations to take action on behalf of children nationwide. We believe that all children have the right to healthy environments in which to thrive, and environmental health for all kids means clean air, clean water, and products free from harmful chemicals. Next slide, please. So I'd like to start out with a bit of background. Like I mentioned previously, our work focuses on looking at the intersection between human health and environmental hazards like pesticides, toxic chemicals in consumer products, air pollution, and much more. We promote preventative research, advocate for policies that place children at the center, education and mobilize action. And in 2022, we celebrated 30 years of our work. Next slide, please. Okay, sorry. Okay, so there are a few ways to support Children's Environmental Health Day. So for example, you can sponsor an event, become a CEH Day partner that I will share more in a bit. Request a CEH Day proclamation. So this is writing to your representative to request a city, county, or state proclamation that declares October 12th Children's Environmental Health Day to increase awareness, spreading awareness, and also sharing your story. Why is Children's Environmental Health Day important to you? Next slide, please. Okay. Sorry. So partners are a big part of what makes Children's Environmental Health Day so special. Partners collectively amplify children's environmental health concerns and drive action for positive change by encouraging real groundswell of activities, often online. And CEH Day partners span from public health, healthcare, and housing, national school and childcare organizations. And we currently have 130 official CEH Day partners, including the Maryland Public Health Association. These are some of the logos listed here, and partners can be individuals, national, state, or grassroots organizations, offices, businesses, or coalitions. So really it's anyone who is advocating for clean air and water, safer food and products, and healthier places for children to live, learn, and play, and wants to be involved with Children's Environmental Health Day. Next slide, please. So you can either go to our website that using the link or the QR code that you see on the screen. And there you will find resources and also toolkits to make it easier for you to advocate and increase awareness on Children's Environmental Health Day. I know that everyone has, super tight schedules, so that's why we made these toolkits just to make it a lot easier for you. Next slide, please. Yeah, so using the QR code, this would also lead you to a Google form if you are interested in becoming a CEH Day partner with us. So, feel free to use the QR code, or you can also send me an email if you have any additional questions, or if you have other ideas in how you would like to also advocate or become involved. Next slide, please. Oh, that's it. Thank you, everyone, for your time.
Thank you, Roxana. And thanks, everyone. I'd be remiss if I did not mention that if you're feeling inspired right now, there's an active open, you don't want to wait till January to testify in front of the Economic Matters Committee. You can actually right now make comments on Maryland's climate pathway, which is, in 2022, and there was a lot of health effort behind this. We passed the Climate Solutions Now Act, and Maryland now has the most ambitious short-term greenhouse gas emissions reduction goals of 60% by 2031. And the state is right now actively working on a plan to reach those emissions reductions. So great goal. How do we get there? And a lot of the policies and initiatives that Delegate Charkoudian talked about is how we get there. But that has to be sort of written into the plan that MDE is writing right now that's due at the end of the year. And so you can have your voice heard now in support of some of those initiatives by commenting on this plan directly through MDE, or Maryland LCV does have a comment page up to make it easy to sign on that way as well. So just wanted to make sure we mentioned that opportunity going on right now. And Children's Environmental Health Day is October 12th. And so that's a great day to tell your story about how emissions reductions are really important to improve children's health. Better air quality means better lung health for kids. And writing that as your reason for why you support the state in its emissions reductions is a great CEH Day action. So we hope to provide all of you with these types of actions and collaboration with your peers. You are not alone in this. We are all working on this, and we need your voice in this work. And so you can join us. The Climate Action website we've been sharing in the chat has a sign up opportunity. And there's a group of us who meet pretty regularly to talk about the ways health professionals can act on climate. And so we're asking you to join us in that. Take the training, come on December 8th, join our monthly calls, and we hope to see you in this work. I'm going to hand it back over to Francis from Elders Climate Action, who's an active part of this work for sure, to walk us through any other questions we might have before we close out. And this is for any of our speakers. So thanks so much.
Thanks, Rebecca. Those are great opportunities. We also have some great questions. One is about how do we fund all of this? There are some things from the infrastructure law, from the Inflation Reduction Act. Maybe there are other funding opportunities. So how can we pay for some of these great ideas?
Dean, do you have? I'm just kidding. I think that's a question. I think that it is a complicated question. And I think one of the challenges is that we've done a lot of funding of clean energy through surcharges or RECs or things that end up on a utility bill. And we really need to move away from that, because that is kind of the most regressive way to do it. One of the things that I did in the Power Act with offshore wind is I came up with a first of its kind way to subsidize offshore wind development that was not on a utility bill. It is in the state budget, so there's still money going towards it, and it's taxes that pay it, but taxes are more progressive, not as progressive as I want them to be, but they're more progressive than rates are. And so that's something that we need to be thoughtful about. But as we have these conversations, one of the things that's really important to remember is that fossil fuels have been subsidized for about 100 years and continue to be subsidized. And so we actually need the federal government to take a look at. Most of that is at the federal level, a little bit of it is at the state level. Really look at all the places where we're subsidizing fossil fuels, because those would be obvious, easy answers of where to move money from that into clean energy. I also think that we should be suing fossil fuel companies at a rate much higher than what we're doing. I've talked recently to the Attorney General of Maryland and urged him to get going on suing the fossil fuel companies. I think that what we saw with cigarettes and what we're starting to see with opioids is a way to get the companies that have caused the most damage to our health to pay for some of the response to that. And so really think that's a crucial piece of what we need to do. I also think, I do think that we're in a great place right now, which is with the IRA and the IIJA. Those are phenomenal in terms of game changers, in terms of what we can do over the next couple of years to really move the needle on clean energy. In some cases, the tax credits that are more permanent are going to be really helpful in the long term. The rebates that will run out eventually. We are going to need to find some other ways to fund those things that the rebates pay for long term. And those are hard conversations that we're going to have. And I think fossil fuel companies ought to pay for them. So we just have to figure out how to get that money from them.
And let me just chime in on this from the perspective of, funding public health initiatives are always very difficult, right? Unless what? Unless you run into a crisis situation, right? All of a sudden, money appeared in the midst of COVID because everybody was running amok and saying, oh my God, we're dying from this. We don't want to get to that stage with climate change. So my sense is, I think the delegate brings up an interesting sort of, comparison, right? Big tobacco was a public health problem. Big tobacco ultimately had to, again, it didn't totally collapse. It still exists. It's still a force out there that needs to be reckoned with. But in essence, funding was diverted, right, through various mechanisms to ultimately, in the ideal, to achieve some public health goal, right?
Great, thank you. We talked about how people's homes being retrofitted can have great benefits in efficiency and decreasing indoor air pollution, but most of that benefit has gone to homeowners. How can we help renters to get those same benefits?
Yeah, it's a great point. So there is the low-income energy efficiency program that I was describing has two aspects to it. So there's something that an individual homeowner can access, and then there's also programs for multifamily housing. And so, and the way that the bill was written is that if a landlord in multifamily housing or a landlord in a single-family home accesses those funds, they have to have a plan in writing with the Department of Housing and Community Development so that the rent doesn't go up after those improvements happen. So it really is designed to make sure that the tenants who are there right now are the ones who benefit from the improvement. So that's sort of currently in place. And what that takes then is organizing so that tenants are going to their landlords and saying, look, there's money here, like you can do this at almost no cost to you. You can electrify this home, you can make this home more efficient, you can make this building more efficient, and we're asking you to do that. And so that is something that I think individuals and organizations are and can and are doing to organize with landlords. I will say that one of the things that I mentioned in passing that I'm excited about the network geothermal bill as it's currently written is that there's systems in place that would electrify and make more efficient entire neighborhoods. And those include multifamily housing. And so it is a way to organize, engage with property owners as well as tenants and make that happen on a large scale. And I'm excited to sort of experiment with it with this pilot. And then I hope that if we get that right, that would include multifamily renters. If we get that right, I think it'll create a model that we can do a lot more of over the course of the next decade or so.
One more question for Delegate Sharkoudian. What would you like most to see from us as healthcare professionals to best support the work you're doing?
Great question. Well, thank you for asking. Thank you for being here. I really do appreciate folks coming to have this conversation because I think making these connections and being really clear about both that the climate change itself, fossil fuels themselves cause public health problems, but also the solutions to climate change can actually be part of the solutions to public health issues. And so those are two different sides of the coin. One is the sort of bad news and the other is the good news. And I'm glad that these connections are being made, and I'm really grateful to the organizations here and to Dean Lushniak for making these connections. I would say, okay, so really quickly, one of the things, if you are, I can see like the names of a bunch of people here, and I know that y'all are regularly in touch with your delegates and senators, and I'm thrilled and grateful for it. But if you are not currently in touch with your elected representative, my homework assignment is always start today, send an email, make a phone call, send a letter, find them at a public event and tell them what you care about. It's really important that they hear from you. I'm a public health professional, care about public health, and I also care about climate change. And I want to know what you're going to do next session to address those two things. So even before you have a bill, make sure the people who represent you know you care about these things. The more folks hear that there's people in their community watching and knowing that they care about these things, the more they're going to vote right, get it right, comment right, introduce the right bills. So that's something that everybody can do today or tomorrow, but not any later than that. I think being in touch with these organizations is really important. So you get the action alert. So when there is a specific bill, and then I would encourage you to come to Annapolis similarly, like come to Annapolis and meet your electeds figure out which bills are most important to you, and then stay involved in those conversations. I've talked a lot about economic matters. That's where I serve. It's where we tend to have a lot of lobbying from the fossil fuel companies and from the utilities. And so other voices are really important in that. But I do think going and talking directly to your representatives so they hear that perspective, your story of your own personal story, the story of people that you work with, the story of people that you know are directly affected by these things, I think is really important to help them. Because keep in mind, elected officials consider 3,000 bills in 90 days. So if you can make that connection between this offshore wind, this pollution, and this child who gets sick from asthma, that's a really important piece of the conversation. So look forward to hearing from you. Definitely come visit my office when you come to Annapolis. I have the best snacks in the place. Some of them are healthy. The baked goods are always vegan. I hope to see you there.
Great. And we hope we'll see all of you in Annapolis and these other opportunities. It's been a great discussion. We could go on for a really long time. There's so much to talk about, but we're all busy people. We need to respect your time. So hope all of these conversations will continue in the future.
Thanks everyone for joining. Thank you to our speakers and shout out, University of Maryland School of Public Health, great research coming out to support important advocacy efforts. Stop by the campus and, visit us when we're working in Annapolis during session. Call your electeds before that. Join us for the training. Suparna, any closing comments from Maryland Public Health Association?
We have a very strong advocacy committee. Please come join us and get more involved.
Awesome. Thank you all so much. We'll see you online at the training. We'll see you on December 8th and then in Annapolis. Have a great day.